Okay, good morning dear students. Today we're going to learn about the MCQs for the P2, and this is the first video for the MCQs. First of all, here we are having which of the following bones is the first one to start ossification. So here we go to the upper limb bones here. So in the upper limbs, which one is the most proximal? That is the clavicle. So the clavicle is actually also the bridge between the axial and appendicular skeleton for the upper portion. So that is the best answer. This is the bone first start to ossify. We can also have a look here at that. Next we are having the second MCQs. Fracture of the humerus at the midshaft is likely to cause injury to which of the following nerve? So let's have a look here on the picture. If at the neck, then we are having here the axillary portion. If we are having at the distal part, then possibly that is the ulnar. And if we see that very closely at the midshaft, very closely, there is a groove. That groove is for the radial nerve. So mostly at the midshaft that fracture happened, that may cause the damage to the radial nerve. Radial is the best answer here. Question number 3, attachment of the bicep brachii or to all of the following except. So again here the except here. So let's see that the bicep muscle attachment, coracoid process, one head, supraglenoid tubercle on another head, and then downside is attaching on the radius. So let's see that we got here coracoid, supraglenoid tubercle, and the radial tuberosity, but the shaft of the humerus it is not attaching. So the best answer is the C here. Number 4, all the following muscles are flexors of the wrist joint except flexor, flexor, flexor. So you look at the C, it is written pronated teres. It's showing its own name that it is not a flexor muscle but performing the pronation. So let's have a look here, that supination, pronation, if you remember these two movements. So the best answer is also the C here. The axis of the abduction and adduction of digits passes through. Let's have a look here, that this part here for the abduction and adduction, we can see that the middle finger, the third one, the axis is there, okay, in both cases. So our best answer will be the center of the third digit. Question number 6, all are heads of triceps brachii except. Let's have a look on the picture. We got here the long head. We're having here the medial and the lateral head. Lateral head is cut here, you can see. So which one is not? We are having, let's see that, the short head. So the B is the correct answer. We don't have the short head. See. Next we got here the question number 7. Which of the following muscle does not form deep relation of the mammary gland? Let's have a look here. The mammary gland is in the superficial fascia, okay, and if we look from the lateral view, we can see here that is a pectoralis major muscle, okay. Under that, under the clavicle, we can see the subclavius muscle and the pectoralis minor. So let's see that from here which thing is taken. Pectoralis major muscle, serratus anterior, and external oblique. So they are present there in the superficially, the breast is touching, but what is that not making the deep? That is a pectoralis minor, because that is already covered. Here you can see that with the pectoralis major it is covered, so it is impossible for the breast to make the relationship with that. So our best answer will be the B. Next we got here question number 8. One of the following structure does not parse clavipectoral fascia. The clavipectoral triangle, I also make the video, you can search in the bar there. So here clavipectoral fascia. So let's have a look here at this picture. In this part, that if we look the parsing here, okay, so this is the lateral side, this is the medial side, that here we can see. So possibly the medial pectoral nerve, okay, so cephalic vein parsing, thoracoacromial artery parsing, lateral pectoral nerve passing. So the best answer will be the medial pectoral nerve, which is not passing from there. Question number 9. Which of the following artery does not supply the mammary gland? Superior thoracic, lateral thoracic artery, thoracoacromial artery. These three arteries are present anteriorly and they're supplying. You look at the word thoracodorsal, it went to the dorsal side already. So the dorsal breast is at the anterior side, ventral side, but this artery is going to the dorsal side. So how it can supply? So let's have a look. The best answer is B, but let's have a look here that if we are looking at the posterior side, we can see here the subscapular artery and the posteriorly this part here, thoracodorsal artery is brand. It is going posteriorly. How it can supply to the breast? So the best answer is the B. Number 10. Axillary sheath is derived from. This question is something that belongs to the embryology, actually the origin. So axillary sheath is derived from the prevertebral fascia. Okay, let's see that this is the prevertebral fascia, and from here we can see that the brachii plexus is coming down from the and following this pathway, and from here the vessels, so from the axillary inlet they are passing through. So that is the axillary sheath derived from the prevertebral fascia. So our best answer here is the B, prevertebral fascia. So up to here, thank you very much. See you in the next video.